Welcome back to Drug Calculations with Nikki. Today we're going to be discussing pounds to kilograms and calculating dosage based on supply. During our last class in May, we were given this worksheet in class practice for calculating pounds to kilograms and calculating dosage based on supply. This is what our homework was based off of, and there was some confusion, so I'm going to go through these practice problems with you. So first off, we were given the patient's weight in pounds. And remember, if it just says the patient's weight in pounds, which was 121 in this case, don't let that trick you when it comes to the Clark's rule. The Clark's rule is for calculating pediatric dosages. So if it just says the patient's weight in pounds and doesn't say the child's weight in pounds, then you don't need to use the Clark's rule. Clark's rule is only when you see the child's weight. So if we just see the patient weight, then you don't need to worry about Clark's rule, and I think that's where we were seeing some confusion. So on this one, it says that we have a label that says, give 20 milligrams of medication for every kilogram of patient body weight. So already we're seeing we have pounds here and kilograms here, so we know we're going to need to do a conversion. And if we get out our conversion sheet, on the very top there it says, let me grab this color here, that 1 kilogram equals 2.2 pounds. So we're going to need that in a little bit. Okay, and then it says the concentration of the medication is 500 milligrams per 1 milliliter. And concentration, that's just another way to say supply. So you can just think of that like your supply. And then the order, it says, administer this medication BID based on label instructions. And BID, looking at our sheet here, means twice a day. So it says administer twice per day based on label and instructions. So the first question on our worksheet was, how many kilograms does the patient weigh? So we're going to need to do our conversion. So in this case, we know that our patient's weight was 121 pounds. So we take that over 1, and we want to find out our answer in kilograms. So kilograms is going to go on the top, pounds on the bottom. So we know 1 kilogram per 2.2 pounds is the conversion. So then pounds are going to cancel out, which means that we will take 121 divided by 2.2 to get our answer in kilograms. So we take our calculator and we take 121 divided by 2.2, which is going to equal 55. So the answer to the first question is 55 kilograms. That is how many kilograms our patient weighs. The next question is, how many milligrams should the patient receive per dose? So our instructions are, give 20 milligrams of medication for every kilogram of patient's body weight. So let me grab another color here. So right now we're trying to find out milligrams per dose. So we know that our patient weighs 55 kilograms. And for the medication, we want to give 20 milligrams for every kilogram patient body weight. So we can just take that times 20 milligrams. So 55 times 20 is 1,100 milligrams per dose. And that's the answer to the next step. Now the third question is, how many milligrams will the patient receive per day? Well, based on the order, we see that it's going to be administered twice per day. So we know that for every dose, it's 1100. So we just take 1100 milligrams times 2, which is going to equal 2200 milligrams. So that's going to be the answer to the third question. And the final question is, how many milliliters will the patient receive per day? So now we need to figure out how many milliliters. So we're going to do our conversion. So we know that we're looking per day. So we know that the patient is going to get 200 or 2200 milligrams per day. So that is going to be our dosage. And then we're going to take that times our supply. And we know that our supply, which was given as a concentration, was 500 milligrams per 1 milliliter. So we want to put milliliters on top because that is how we want the measurement we want our final answer in. And then milligrams is going to go on the bottom. So we were given 500 milligrams per 1 milliliter. The milligrams are going to cancel out. So we're going to get 2200 divided by 500 to get our final answer in milliliters. So I'm going to use my calculator, 2200 divided by 500, and that is going to equal 4.4 milliliters. And that's the final answer for the fourth part of that question. Okay, now we'll go ahead and do the next question. And for this one, it was the patient's weight in pounds was 176. Our label says give 15 milligrams of medication for every kilogram of patient body weight every day. The concentration, or you can think of that as a supply, is 600 milligrams per 1 milliliter. So the first question is, how many kilograms does the patient weigh? So once again, we can just do 176 pounds over 1 times our conversion. So we know that there is 1 kilogram per 2.2 pounds. And pounds cancels out. So we do 176 divided by 2.2. It's going to be 80 kilograms is the answer for the first question. The next question is, how many milligrams should the patient receive per dose? So we know that it says that our patient is 80 kilograms and they want to give 15 milligrams for every kilogram of patient body weight every day. So we just take 80 times 15, which is going to be 1200 milligrams for our second answer. And then the third answer is going to be, how many milliliters per dose should this patient receive? So we're going to put down 1200 milligrams over 1 for our dosage, and we're going to take that times our supply, and we want to get our final answer in milliliters. So milliliters goes on top, milligrams goes on bottom, so they cancel out. So we're going to put 600 milligrams, and I'm getting that from the supply, over 1 milliliter. So we just take 1200 divided by 600, which is, of course, 2. So the answer for the last question is 2 milliliters per dose.